California. You're recognized for 5 minutes to discuss the amendment.
Thank you very much, Mr. Chairman. I move the strike. This bill before us doesn't just decimate health care for the most vulnerable populations. This bill will tear irreparable holes in the fabric holding many of our communities together. It's no secret. This bill would undoubtedly force many of those hospitals, clinics, nursing homes, and emergency medical services and other providers to close their doors. In California alone, this bill will result in tens of billions of dollars of cuts to hospitals over the next 10 years. Many cuts come from limiting state-directed payments. If a hospital shutters a labor and delivery ward, that means no one has a place to go to give birth. When more moms-to-be are forced to drive hours to the closest birthing facility and are having dangerous labor complications as a result, Republicans will be to blame. Medicaid is the single largest payer for long-term care in this country. If an assisted living facility can't afford to keep its doors open after taking a major hit to its biggest revenue stream, that means no one can find a bed. When more of our constituents can't find a safe and comfortable place for their parents or grandparents to grow old, Republicans will be to blame. If an emergency room closes, that means no one has a place to go when they need immediate care. And if emergency medical services have to take an ambulance off the road, that means one less ambulance available when anyone has a medical emergency. When more people are dying en route to the closed ER after a major heart attack or accident, Republicans will be to blame. These cuts will be felt acutely by each and every person in our districts. We also need to consider that our healthcare facilities are often the anchors of our communities. They are often the largest employer and major economic drivers in their regions. I'd like to submit for the record this letter from over 200 California organizations about how detrimental these cuts will be, not only to the health of more than 15 million Californians, but also to the basic economic foundations of the entire state. Medicaid supports over 500,000 jobs in California. In my district alone, 12,000 employees, doctors, nurses, technicians, and support staff rely on Medicaid funding for their salaries. I know I'm not the only one in representing a district where healthcare is one of the top employers. If Republicans succeed today, millions of livelihoods across the country will be at risk. In California, we've seen this story play out. Just a few years ago, a local hospital in the rural Central Valley of California, Madera Community Hospital, had to close its doors due to financial struggles. Predictably, the health effects on Madera residents were immediate. Women were driving hours to give birth, cancer patients had nowhere to go for their prescriptions. Hospitals in neighborhood areas were overflowing. And soon after, Madera was feeling the vacuum effect of one of its major institutions closing. Thousands of people lost their jobs. Businesses closed. People who could afford to moved out of town. Others were left unemployed and scrambling. Madera basically turned into a ghost town. Fortunately, Madera was able to access emergency state funding that allowed it to reopen its doors. But hospitals can't be started up overnight. Many of the doctors, nurses, and support staff who worked at Madera found other jobs when it closed. It's been no small feat to get all the critical services back to full capacity. The cuts in this bill will be the final nail in the coffin for a community hospital that is already teetering in the brink. Are Republicans ready for this story to play out in their districts? For their constituents to be out of jobs, out of health care coverage, and have nowhere to turn in an emergency? I yield back the remainder of my time.